this week we're going to be going over shingles and the shingles vaccine and how you can use it to protect yourself.
All right, so what is shingles? Shingles is a painful rash. People get shingles when the varicella-zoster virus that causes chickenpox reactivates in their bodies after they have already had the chickenpox.
Continuing to look at what shingles is, more than 99% of Americans born before 1980 have had the chickenpox, even if they don't remember it. I know something that my mom likes to talk about is how she got taken to a chickenpox party so that she could catch it as a baby and not have to deal with it later on. So, a lot of people, even if you don't remember having chickenpox, did experience it if you were born before 1980. The risk for shingles and more serious complications increase as you get older, if you've had medical conditions that affect your immune system, or if you're taking drugs that also impact your immune system, like consistent steroids or drugs for organ transplants.
All right, about 1 in every 3 people will have shingles in their lifetime. Shingles can sometimes lead to long-term complications like nerve pain and or vision loss. The best way to protecting yourself against shingles is to be vaccinated.
So, just looking at causes and spread of shingles, if you are somebody that currently has shingles, you cannot get shingles from that person. So, that's important because that's a big misconception. People think if you're near somebody with shingles, you can get shingles, but where it's important is that you can get chickenpox from somebody who has shingles. So, if you've never had the chickenpox or you've not been vaccinated for the chickenpox, you can get chickenpox from a person with shingles, and that can lead to shingles later on in life. People who have never had the chickenpox or didn't get the vaccine can again become infected from somebody with shingles. And these people typically come in contact with the virus through an open sore or blister that you develop during shingles, and just coming in contact with that fluid on your skin, or if you accidentally breathe in fluid from a blister. And people with chickenpox are way more likely to spread the varicella virus than people with shingles are.
All right, so now let's talk a little bit about prevention. So the CDC recommends 2 doses of Shingrix to prevent shingles and related complications in adults 50 and older. So even if you've already had the previous vaccination for shingles before 2017, it is still recommended that you go ahead and start this 2-dose series of Shingrix, as the one previously only covered 50%, but Shingrix covers 90%, 97% actually. Shingles is also recommended for adults 19 years and older who have weak immune systems because of disease or therapy. All right, so if you have shingles, the best practices are to go ahead and cover up any rashes that you have from shingles. It can help lower the risk of spreading the shingles. And people with shingles cannot spread the virus before blisters appear or after rash scabs over. You should avoid touching or scratching the rash and make sure that you wash your hands often to avoid spreading. Avoid contact with pregnant women who have never had chickenpox or the vaccine, premature or low birth weight infants, and people with weakened immune systems.
So, signs and symptoms of the shingles, some early signs are pain and itching or tingling in that one area. Something misunderstood about shingles is it's unilateral. That means it's only affecting one half of your body. It can be the left or the right side, but typically in the area where the rash will eventually develop is where you have the pain and the itching and the tingling feeling. This can develop several days before you ever see a rash, and you also can run a fever in that time frame. Some common symptoms is that it appears again in that single stripe down the left or the right side of the body. That stripe can also form on the face on either side. It sometimes can be way more widespread, like chickenpox, but that is not very common, but it could be the case. Some complications, long term effects. You can experience long term nerve pain, which is considered as post herpetic neuralgia. And that's just pretty much kind of like neuropathy. If you've heard of neuropathy, it's consistent tingling, numbness, and just pain in that area where the rash was due to the nerve damage that shingles causes. And it typically only occurs like the pain in the area where your rash was, even after it's cleared. And there's been mixed reviews, but some people say the pain continues for months to even years after having shingles. Also, for people that get it on their face, if the shingle spreads to your eye, it can unfortunately cause vision loss. So, again, a few more common symptoms are fever, headache, chills, and an upset stomach.
All right, so now let's talk a little bit about who should get vaccinated. If you are 50 and older, you should get vaccinated. There is no maximum age for getting vaccinated. You should also get the vaccine even if you've already had shingles previously. If you had shingles, you know how bad it hurts, you know the pain that it caused. So you should definitely recommend to anyone go ahead and get this shot. Even if you received the shot previously or you've had the varicella vaccine, you should receive the vaccine whether or not you remember having the chickenpox at all, as Cindy said earlier. What if you've already had shingles? The vaccine can prevent you from developing a future occurrence of shingles. So even if you've already had shingles, you should still get the shot to cover you for protection for so you don't get it again. There is no specific length of time that you need to wait after having shingles before you can receive the vaccine. You generally just want to make sure that the rash has cleared up before you get vaccinated. Other considerations, adults with weakened immune systems and no documented history of chickenpox disease, chickenpox vaccination, or shingles should also talk to their doctor before receiving the vaccine.
So we talked about who should, but now let's just talk about who should not get the vaccine. So you should not get the vaccine if you've ever had a severe allergic reaction to any component of a vaccine, or if you had the first shot of Shingrix and you had an allergic reaction to that. Other people who should not get the vaccine are people who actively are infected with the shingles. So, what we mean by that is if you're in that few days before you develop the rash, or if you have the rash on you, it's not recommended just because that can kind of send your immune system into overdrive. But after the rash clears up, you should be good. And then people who are pregnant at this time is not recommended just because they don't know the side effects that could be on the baby. People who are currently sick should wait until their infection clears up before receiving the vaccine. And when we say currently sick, if you have a runny nose, you're still good to get the vaccine. But if you have COVID or the flu or anything like that that's really impacting your immune system more, it's best to wait until after that's cleared up.
Yes. So a lot of people wonder whether or not the vaccine is safe. Studies have shown that Shingrix is a safe vaccine. Clinical trials show that the vaccine was not associated with serious adverse effects. The vaccine provides strong protection against shingles and post-herpetic neuralgia, the most common complication that comes with shingles. In adults 60 to 69 years old with healthy immune systems, Shingrix was 97% effective in preventing shingles, as the previous vaccine was only 50% effective. In adults 70 plus, Shingrix was 91% effective, and in adults 50 and older, Shingrix was 91% effective in preventing PNH and 89% effective in adults 70 and older. In adults with weakened immune systems, Shingrix was between 68% and 91% effective in preventing shingles, depending on their condition that affects the immune system. In people 70 years and older with healthy immune systems, Shingrix immunity remained high for at least 7 years after vaccination.
So, some possible side effects for receiving the Shingrix shot is that most people you will hear that it causes a strong immune response. So, for some people, that means that like you might want to get the shot when you have 2 to 3 days off after, just because it can make you feel a little bit like you have a cold. So, it's typically comes with like the soreness, a little bit of red spot, upset stomach, typical things that you would think of when you've gotten a vaccine. A lot of people compare it to the first COVID shot, if you ever had the COVID shot, but nothing major. Most people report mild pain, and a lot of people take over the counter supplements such as ibuprofen or acetaminophen, and that clears up most of the issues. Some other side effects that people have reported is feeling tired, muscle pain, a headache, shivers, fever, stomach pain, nausea. In very rare cases, you might see Guillain-Barré syndrome, but that is a very serious reaction to vaccines that anybody could experience from any vaccine. And again, very rare. It's just something we like to bring up so you're aware of it. So if you have side effects, you would know to look for it.
All right, and that's all we have for our shingles presentation on today. If you have any questions or if you'd like to get the vaccine, you can contact us here at the pharmacy. Our phone numbers are on the screen and location and website as well. Thank you.
Thank you, guys.